Hey everyone, it's Dr. Sheena Bhuva, Physical Medicine and Rehab Physician at Texas Back Institute. I hope everyone's staying safe and healthy during these extraordinary times. I know it's been really tough staying at home and sheltered in place, but no, we're all in this together and hopefully we'll be able to move on sooner rather than later. In the past few weeks, you may have heard of the term telemedicine. So today I wanted to go into a little bit more detail about what exactly telemedicine is and how we're using it to see patients. So telemedicine before the pandemic was mostly used for patients who lived in rural areas or in places where they didn't have access to particular physician specialties. But over the past few weeks, a lot of those restrictions have been lifted. And so not only can we see our follow-up patients, so patients who we had been seeing normally in the clinic, but also patients who are new, so patients who we had never been seen, who have never been seen before in clinic and are having issues with neck and back pain. And with telemedicine, there's usually two components. One is the audio portion, where both the physician and the patient can hear each other, as well as the visual component, where both parties can see each other. And while this may be a new platform for a lot of our patients, the actual components, meaning the audio and the visual components, are not necessarily as new as you would think, since a lot of patients use FaceTime, WhatsApp, Google Hangouts, Skype, every day in their day-to-day activities, whether it's talking with friends or family across the country or even the world. So fortunately, it's been pretty seamless for a lot of our patients, which has been really nice. So with a telemedicine visit, usually, we start off by doing a history. So this is the same kind of history that you would get, when seeing a patient in the clinic. So, where is your neck or back pain? Do you have any numbness or tingling? Does it go down into the arms or legs? We can also ask for red flag signs or symptoms, such as any numbness or weakness, any bowel or bladder issues, fever, chills, anything like that. And then what's nice with the telemedicine component is with the visual aspect, you can oftentimes, share your computer screen or, your laptop screen. So you can go over MRIs, X-rays, and other imaging with the patient. So the patient is able to see exactly what you're seeing on your side. They're able to see it on their side as well. So that's been, really nice to maintain that personal interaction. And then in addition to, going over images, you can also do a pretty good exam. So what I have patients do is I have them walk so they can stand on their heels and toes. You can check range of motion of their neck and their back. You can check sensory exam, by just asking the patient, do they have any decreased sensation anywhere in their legs or in their arms. You can also get, creative. Sometimes I have patients jump or squat, if they're able to do so. In addition to, the physical exam, just like you would during a regular office visit, once you go over the history, the imaging, and the exam, you come up with a plan. So whether that would be physical therapy. Now, a lot of physical therapy places are obviously closed during this pandemic, so we are offering telehealth physical therapy, and some of the other physical therapy groups around the area are also doing the same, so that's been really nice. In addition to talking about any possible injections or even surgeries that we would be able to do, once we're able to start doing elective procedures. In addition to, physical therapy and talking about potential injections or surgery, we can also send medications electronically as well. So that's pretty much it, when it comes to doing a telemedicine visit. Still able to, provide the care that we usually do, and patients so far have been liking it. So give it a try, and please continue staying healthy and safe, and like I said, we'll get through this together. So bye.